What is intrahepatic cholestasis of pregnancy, or ICP? It is a condition that a patient's liver is very sensitive to female hormone. So during pregnancy, especially the third trimester, when the level of estrogen and progesterone are very high in the blood, the mother's liver react to this to react to her own hormone that are produced by her own womb. So it typically affects a pregnant woman from the third trimester, almost always after week 31 or 32. The symptom will be itch. They feel itch. The itch gets worse and worse and worse. It's worse at night and it's worse when it's hot. When they do a liver test, the liver test is abnormal. They normally present to the gynecologist and obstetrician. A good and experienced obstetrician will have thought about that. A lady in the third trimester present with a rash, present with an itch, and the liver test is not normal. Bingo, is probably ICP. Sometimes they manage themselves, and sometimes they refer to me as a hepatologist to take care of these patients. I will normally go through the history. Such patient typically has some characteristic. Because the liver is very sensitive to estrogen and progesterone, if they ever have taken contraceptive pill before, in the past, they may have a reaction at the same time. So if you say, oh yeah, when I took OCP when I was younger, I did have the itch. I stopped OCP, I'm fine. That will give it a hint. Another thing is that it is actually the pregnant woman's inborn sensitivity to the estrogen and progesterone. So it will happen again and again and again. So typically we ask them, in your previous pregnancy, do you have the same problem? Typically, they say, oh yeah, same thing. When the last pregnancy, about week 35, week 36, I have some itch. But after delivery, it's okay. Yes, another key point is that after delivery, it is okay. But of course, if the patient never take OCP, never had pregnancy, the first pregnancy, and now have an itch, then we can't really be absolutely sure. So how do we confirm it? We normally want to make sure that the abnormal test and skin itch is not caused by any other possibility, such as maybe an allergy, maybe some eczema, or maybe dengue fever, for example. So we have one special test that we can confirm. It's called the fasting bile acid level. It has to be fasting because after food, our bile acid level in the blood may be a little bit up. So to show that patient have ICP, we need to do a fasted blood sample to test for something called bile acid. The lab doesn't do it every day. It's not a common condition anyway. So usually I'll tell the patient, do the test today, come back a week later. If indeed it has an elevated bile acid level, faster sample, and there are no other causes to account for that, like a gallstone, a liver problem kind of thing, then we can make a diagnosis of ICP. ICP diagnosis is made as what we call a clinical diagnosis. That means we make it based on our judgment. It may not be 100% accurate. So once we confirm ICP, we will tell the patient a few things. The itch may get worse when they are progressing in the pregnancy. They need to keep themselves cool and cool all the time. Turn the aircon to sleep at night. Avoid being in the hot sun. Avoid sweating because that makes the itchy worse. They also need to monitor the fetus more carefully because some studies show that when they are the pregnancy exceeded 37 weeks, they may have a high risk of bad outcome from the pregnancy, like a fetal death. So if we confirm the ICP, we will tell the patient this ICP may get worse. This ICP may harm your fetus, especially after 37 weeks. So most experts will say, you've got ICP, let's plan for a cesarean section, an elective cesarean section at week 37. Some obstetrician will give it a try to induce a labor at 37. If they can give it by themselves, that's great. If they can't, they will then do an elective cesarean section. We try to deliver the baby when they hit 37 weeks. There's some medication that we can give to reduce the itch, and there's some medication that we can give to make the liver function better. So we'll tell the patient it's ICP, let's give you some medicine to help the itch and help the liver function improve, but do plan for an elective cesarean section at week 37. After delivery, the itch will almost always go away within 24 hours. All my patients told me the same thing. But one thing you have to warn the patient is that if ICP confirmed, then next time when you get pregnant, it will happen again, so get prepared. To sum up, ICP is one of the more common liver conditions, even though it's rare. It always occurs in the last trimester, the third trimester. They present with itch, usually worse when it is hot, and patients have some telltale signs such as they have the same symptom of itch when they take contraceptive pills in the past. It will have happened in the previous pregnancy, and the moment the pregnancy is finished, say we have delivery, the itch go away within 24 hours. Hope you learned something.